What is COVID-19? What do you understand about COVID-19? Okay, let me explain briefly. Coronavirus disease 2019, COVID-19, is defined as illness caused by a novel coronavirus now called severe acute respiratory syndrome coronavirus 2 SARS-CoV-2. It was first identified amid an outbreak of respiratory illness case in Wuhan City, China. On 30 January 2020, the World Organization WHO declared the outbreak a public health emergency of international concern. Coronavirus are a group of viruses that look like a crown with protein spike. It can infect humans and cause diseases. Because of that, as a new virus, no one has antibodies. Any person may be exposed to infect. They are unaware of the infection and spread it to others.
Infectious diseases are transmitted from person to person through direct or indirect contact. Certain types of virus, bacteria, parasites, and fungi can all cause infectious diseases. Malaria, measles, and respiratory diseases are examples of infectious diseases. Many diseases are spread through contact transmission. Recently, there is a new infectious disease known as coronavirus that has spread all over the world. COVID-19 is mainly spread from person to person. A person can be infected from respiratory droplets when uninfected person coughs, sneezes, and talk. A person may also get it by touching the mouth, nose, or eyes. Coronavirus can be transmitted from person to person, usually after close contact with an infected patient. For example, at a home, at a workplace, or at a health care center.
So, what we need to do to keep the pandemic COVID-19 spreading is firstly, keep a distance of at least 1 meter from each other. This can prevent us from contacting others when we are in supermarkets or public places that may have COVID-19 symptoms. Second, always use a mask when outside from home, public places, and supermarkets. By using a mask, it can help prevent the spread of the virus from the person wearing the mask to others. The mask alone does not protect against COVID-19 and should be combined with physical distance and hand hygiene. The next step is to wash your hands regularly. Use a soap and water or hand sanitizer when after holding something or before holding something. Avoid holding your mouth or nose when in public. In addition, cover your mouth and nose when sneezing and coughing. Stay away from others when you want to be clean or cough. Lastly, stay at home or do not go out if you find yourself unwell and have a high fever. This can prevent the virus from infecting other people.
Since COVID-19 attacked Malaysia, government has made a rules and standard operating procedure as known as SOP to continue living in the new norms. Therefore, as a Malaysian student, we have to follow the SOP like social distancing, which is 1 meter, and temperature check every time we enter the lecture room. In addition, the students should also need to wear a mask and wash our hands often with hand sanitizer to keep it clean. If a student has symptoms such as fever, flu, and cough, students should immediately go to clinic for treatment or get a doctor advice. As a student who followed the instruction and suggestion from the government, I took the initiative to bring my own spoon and fork when eating at cafe to avoid from sharing. Secondly, When I am in a mall, I will make sure my body is in a good health before going out to public area. In addition, I will make sure I will wear a mask and bring hand sanitizer to make it easier for me to disinfect my hands. Next, the government has issued the instructions so that when you want enter a shop, we need to scan using my Sejahtera apps, because if there have a positive case COVID-19, Ministry of Health, it's easy to track our location. During this pandemic COVID-19, we are more encouraged to stay at home because it is more safer. In addition, we also must use hand sanitizer and wear the mask all the time when we are go out from home. Last point from me, when I need to entering the plane, I will make sure my body is healthy and always wear a face mask and face shields before boarding. The airlines will check our temperature so that all passengers in a good health and allowed to board the plane. Furthermore, all airlines in Malaysia has taken the initiative by following the procedure by cleaning the aircraft with a disinfect at least 2 hours before and after the next flight. All the crew are required to wear a mask and glove when providing food to passengers. This is because to avoid direct contact with an object or when preparing food to passengers. Therefore, passengers and crew need to carry out prescribed procedures so that all can ensure safety in terms of health, especially during this pandemic COVID-19. In conclusion, all of us should take care of ourselves and surely need to follow the government instruction. Thank you.
I will continue this presentation. For the last part is what people can do to help stop the spread of coronavirus. For the first step is we need to maintain the cleanness. Make sure you wash your hands with soap and water or with hand sanitizer. This can help to kill the virus at hand. Don't forget to wear a mask when you go to outside. Wearing masks can help to prevent the spread of the virus from the person who wearing the mask to others. Wearing masks alone do not protect against COVID-19 and should be combined with physical distancing and hand hygiene. Follow the evidence provided by your local health authority. Maintain a safe distance from anyone who is touching or sneezing. Wear a mask when physical distancing is not possible. Don't touch your eyes, nose, or mouth. Cover your nose and mouth with your bent elbow or a tissue when you choke or sneeze. Stay home if you feel unwell. If you have a fever, choke, or difficult breathing, seek medical attention immediately. That's all from me. Thank you for watching. Don't forget to keep safe, keep distancing, and stay safe.
In conclusion, this 2019 COVID-19 is the recent strain of coronavirus that has not existed previously described in humans. The eruption of new virus infection among people are usually of common health interest, particularly when there's small cognition about this feature of this virus, how it spread between people, how severe are the resulting infection, and how to treat them.